In 2021, the Department of Health and Human Services, HHS, through the Centers for Medicare and Medicaid Services, CMS, released the Transparency and Coverage Final Rule, which are a set of policies aimed at improving the transparency in healthcare costs by requiring hospitals to make their prices available to consumers, with the hope that, quote, making this information available to the public will drive innovation, support informed, price-conscious decision-making, and promote competition in the healthcare industry, end quote. Understandably, it can take some time to roll out this kind of a policy for hospitals to figure out the costs of their actual services, to make that information available in a format that's accessible, etc. So I'm a professor in the biomedical field, and I've been following this rollout such that every year I try to see if I, as an extremely well-educated, medically literate, price-conscious consumer, can figure out how to use the outcomes of this final rule to determine which hospital I should go to for a shoppable medical service of interest. You can see the outcomes of my efforts from previous years in blog posts I'll link via the description. But now it's almost 2025, almost 4 years since the final rule was first issued. And according to the CMS, by now, all hospitals should have made the costs of 300 shoppable medical services available so that consumers, like us, quote, will be able to get real-time and accurate estimates of their cost-sharing liabilities for healthcare items and services from different providers in real time, allowing them to both understand how costs for covered healthcare items and services are determined by their plan, and also shop and compare healthcare costs before receiving care, end quote. Like the majority of Americans, I do have private health insurance through my employer. It doesn't really kick in until I've met my deductible, which is like $2,000 for the year. So I would still like to shop around to minimize my out-of-pocket costs. So come on a journey with me to see if we can figure out which hospital I should go to for a shoppable medical service of interest. So let's say I've been getting some sensations down there and peeing a lot. So I'm looking to get a urinalysis done to, pee in a cup and see what's in there. So according to the CMS, urinalysis is among the list of shoppable medical services that hospitals should be making available now. And actually, it looks like there's two types of urine analyses. One that's a manual urine analysis with examination using a microscope, and one that's the automated urine analysis. I actually don't know what the difference or the benefits are between these two. I assume the automated one is cheaper than the manual one. Yeah, wouldn't it be nice if I just had somebody with actual medical training to tell me which test I need and not have to think about it myself? But anyways, here we are. So let's first take a look at Google Maps to see what are the hospitals in the Baltimore, Maryland area, because even if there is a hospital offering super cheap prices, I still need to be able to get there and factor that into the costs, especially with gas prices these days. So yeah, it looks like I live in a pretty hospital-dense area, so I do have a good number of options. So let's consider comparing between, say, Mercy Hospital, GBMC, MedStar, Johns Hopkins, and Sinai. Right, so let's look for Mercy Hospital shoppable medical services. How do I actually find the prices? So after a lot of digging, I think I found the right file. Yeah, the file here reflects the average charges for items and services provided by Mercy Medical Centers as of January 1st, 2024. This type of file is commonly referred to as the hospital's 300 shoppable services. Wonderful, we got it. Okay, so in Maryland, the average rate for hospital services are regulated by this HSCRC, a state regulatory agency, and it sets average hospital prices on January 1st and July 1st of every year. So yeah, right now it's December 2024. So technically I should be probably looking at the July 1st document, but it took me so long to find this one. I'm going to stick with this one. Though the state sets hospital rates as of a certain date, hospital charges are allowed to fluctuate during the course of the year, and detailed charges for certain items may be different than the average rate approved. Okay, so, but yeah, I'm hoping that still we'll be able to get like a ballpark estimate of what our urine analysis will cost. So they actually offer three types of urine analyses. One is auto with scope, one is auto without scope, POC, and one is microscopic. So I actually have no idea what the difference between these are because microscopic is not the same as with scope. But anyways, it looks like, yeah, so this is the standard charge, minimum charge, and discounted cash price. So that's helpful. I would expect to pay around 10 to 20 bucks if I go to Mercy Medical Center for my urine analysis. Great. Okay, so now on to our next hospital.
A few minutes later.
Okay, so I think I found the right file. It looks like this is provided as a PDF instead of an Excel spreadsheet. Let's see, for common lab tests, we have a urine analysis complete, and the average cost is going to be $18.25. Okay, I don't know if there's like a microscope version or this is the automated version, but anyways, I guess, yeah, I can expect to pay around 20 bucks if I go to GBMC for some complete urine analysis test. Fine. Okay, and that means we can go to our next hospital, MedStar. Yeah, we need the shoppable medical services file. And again, now instead of an Excel spreadsheet or a PDF, we have this comma separated file, which is in, again, a different format. Yeah, let's see if they have urine analysis. They have some kind of kidney and urinary tract diagnosis with MCC. I don't know what that is, but it will cost $30,000. Yeah, okay, I don't think I want that. Is there a potassium urine test? Don't think that's actually what I want, but let's take a look. Okay, this is $27, I think. Okay, it's a little closer to the ballpark. What are these columns? It looks like I have a different set of charges for different insurance companies. Wonderful. Okay, but yeah, I guess at the end of the day, it doesn't seem like they won't have the urine analysis test I want, so I'm going to move on. Okay, so the next is Johns Hopkins Hospital. It looks like it actually has a whole tool to help us figure out the cost of getting health care. Yeah, so I'm going to again look for my laboratory tests, urine analysis, and oh, neat, it has actually 3 different options. Yeah, I don't know what the difference is, but okay, fine. Pick insurance. Okay, I still have 2,000 left on my deductible. So okay. Well, maybe I just needed to pick the other urine analysis. Okay, so oh, great. Well, it actually gave me an estimate. The estimates are not a contract, though. These estimates below contains information to help you understand the possible cost of your visit. You'll be responsible for the actual amount charged based on the services you receive. Please note the actual amount may be higher or lower than the estimates provided. Well, wonderful. So our final hospital is Sinai. So I'm actually not sure if this is the right Sinai that's in Baltimore. I think this might be the Mount Sinai. That's a different hospital. But anyways, just for the sake of comparison, yeah, it looks like here we have an Excel spreadsheet, but it's a little bit different than the other Excel spreadsheets we've looked at. Oh, look, there's our manual urinalysis with examination using a microscope and our automated urinalysis test. Neat. It looks like there is a gross charge and a cash price. I don't know the difference, but I'm assuming that the cash price is what I would pay if I use cash. It actually looks like it only costs $1.98 for an automated urinalysis test. and $14 for the microscope one. But actually, I do have insurance, so yeah, let's see. It looks like it's organized by different insurances. So yeah, let's say if I had United Healthcare, why do I have to pay $52.49 for an automated urine analysis that would have otherwise cost like $1, even though I have health insurance that I pay a monthly premium for? Okay, what if I had a different health insurance? Blue Cross Blue Shield? $90.12 for a $14 scope-based urine analysis, or $74. What? Or the PPO? $134.10. For how much they're charging, I can actually just buy a microscope and pee in a cup and look at it myself. Why is this so hard? So, like millions of Americans, it's not like I'm dying right now. So instead of getting this non-urgent care, I'm just going to hope and pray that it's not some totally preventable bacterial infection that's going to spread to my kidneys and land me in the emergency room, where then I'll totally meet my deductible and then some, and contribute to a decrease in my health span and lifespan, and reduce my ability to be a productive citizen and engage in my community.